Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jen Dusablon, your host for today's show. Through this monthly program, we bring you information about Franklin County Home Health Agency's programs and services, as well as tips to help you and your loved ones stay safe and healthy at home. On today's program, we'll be talking about one of the most important things that Franklin County Home Health does is a service of providing care so that you can recover safely and independently at home after surgery or illness. And we'll be talking today about recovering from stroke and other illnesses at home. To do so, I have two guests with me from Franklin County Home Health Agency. Jeanne Dube is our clinical nurse manager in our Enosburg office. Thank you for being here today, Jeanne.
Thanks.
And Eugenia Lamet is a speech-language pathologist here in our St. Albans office. Thank you for being here, Eugenia.
Sure, you're welcome.
So tell us just a little bit more about yourselves, maybe your history at the agency, how long you've been there, and your role.
Sure, I'm Eugenia Lamet. I'm a speech and language pathologist for Franklin County Home Health, and I've worked with the agency for 10 years.
Oh, wonderful.
As an SLP, that's what we call it for short, I assess and treat individuals, kids, and adults who struggle with communication and swallowing. And there are many causes for these challenges, and so our aim is to help encourage people to participate as fully as possible in their lives at home.
Wonderful. That's good work. Thank you for 10 years. That's really great. We're glad to have you on the team.
I was counting.
That's great. And Jeanne's one of our new employees. Tell us about yourself.
So I'm Jeanne Duby. I'm a new clinical nurse manager and a new employee to Franklin County Home Health. I started in September of last year. For the last 18 years, I worked in Burlington at UVM Medical Center in the surgical and pediatric ICU. So this has been a really great transition when you see a lot of the in-hospital things. The transition's been great. I've learned so much about taking care of people in their homes, prevention, education of illnesses with the patients and the families, and
wonderful. It's good to have that background and have it have both sides. Eugenia, did you do services and other types of care before home health care?
Well, I came straight to home health from graduate school, but also in my training worked within schools and the hospital.
Yeah. Good. So we're glad that you found home health care, and thank you for your work in Enosburg. And we've said on the show many times we serve all of Franklin County, so we have an office in St. Albans where you're essentially located, and then we have an office in Enosburg so that our staff can go from there and see the northern part of the county.
Yes.
So it's something a lot of people don't realize we have those two offices, but thank you both for coming. So we have a nurse and a speech-language pathologist, and we want to talk about coming home from illness such as stroke. We'll focus on stroke for a little while. So before we do that, let's talk about what a stroke is and what people experience.
Sure. So a stroke is when a clogged or burst artery interrupts blood flow to the brain. And this interruption to the blood flow then deprives the brain of the oxygen it needs and can affect brain cells to then die. When the brain cells die, the functioning of the body parts that they control is then impaired, and there are deficits that occur. So a stroke can cause paralysis or muscle weakness, loss of feeling, speech and language problems, memory and reasoning problems, swallowing difficulties, and sometimes problems with vision or visual perception, among any other challenges.
Yeah, so it could affect everybody a little bit differently, but in many, it's going to pick an area that. So folks go to the hospital for their emergent care, they receive the care they have in the hospital. How then are they transferred home?
So once they've gotten to the place where they can be transferred home, the doctor makes a referral for home health, which generally is a nursing visit to eval for services, occupational therapy, and physical therapy. And then we also make the referrals for SLP. So it's all about safety and them being able to communicate well, and it is a team effort.
Yeah.
So.
Excellent. So what kind of things is a speech therapist helping someone recovering from stroke?
Sure. So there can be communication challenges with word retrieval, so finding the right word to express a need or an idea or thought. It can be difficult to hold structured discussions, so sometimes the social aspect of communication can be challenged and the turn-taking needed to continue that. And then following, sometimes there is a motor planning deficit that affects speech called apraxia, and so forming the plan to get the word out of your mouth and moving all your muscles to make that word come out can be impaired, and so there's strategies around working on that as well.
Can you give us some examples of specific strategies you might use with an individual and as well as the family? So a lot of folks come home and they have family involved, so talk about those two things.
So it is important to definitely include the communication partners who are the family into the therapy and work on if there are memory challenges, then coming up with strategies to help remember different routines in the day and things that need to be done. So keeping a daily journal, sort of working on calendar skills. I mean, all these things would actually be figured out to work on once an assessment was taken, as far, to see the specific areas that would be challenged.
Yeah, let's back up and talk about your assessment skills. What are you looking for?
Sure. So you'd look for ways in which the client couldn't participate in activities that they used to be able to participate in, things like writing checks or, putting appointments on the calendar or, remembering to feed the cat or dog or things like that. And so that would be, and so once those areas would be discovered, then you would come up with a plan with the family to work on those areas. So like I had mentioned before, as far as word retrieval, you might cue the family to figure out ways to help the person talk or describe the word they were looking for, or to provide a multiple choice question so that they can retrieve that word, or a first initial sound cue so that the individual post-stroke could come up with the word they were thinking
I imagine it's important to sort of talk about patience and not filling in the word for the patient. Right,
and giving them plenty of time to come up with their thought or idea or question. And absolutely.
So assessment, it sounds fascinating in the home, because these are things where, in another setting you may be looking at physically what they can do, but at the home you're mentioning things like feeding the cat, and it's just going beyond it's their everyday life and care at home. So you really get to see and help with a lot of things in that setting.
Right.
That's really wonderful. Talk about working with the team. So, and that also includes occupational therapy and physical therapy and nursing. Talk about how you work together as a team to help this patient.
Sure.
Sure. So most generally the nurse goes in first and does an overall assessment. We assess the patient, of course, for their safety needs, how they're getting around in the home. We assess the home, making sure any fall precaution like rugs and things like that are taken care of. They have cleared paths. We even look at the bathrooms and making sure they have bars and things to safely come in and out of the shower if needed. And we work closely with the rest of the team for communication needs, the ability to walk safely, and if they need any durable medical equipment like a walker or cane, making sure they have enough support in the home with other family givers, caregivers, and making sure that everybody's educated. Good nutrition, that it's more like their hypertension and
so education is a very important piece, because we provide services for a set amount of time, but with the goal of discharging patients so they can continue this type of care, or a caregiver might be able to help continue that. Wonderful. You mentioned swallowing as well, again, and nutrition. Let's talk some more about that and how that plays into a person's overall health who's recovered from a stroke, swallowing and eating.
Sure. So sometimes if a person has a challenge with swallowing, of course, they can be at risk for aspirating and having food go down into their lungs, which can then result in, further infection or pneumonia. And so it's really important to look at assessing where the breakdown might be, and you'd probably get a lot of information from the hospital or the acute rehab that they had been in, and to know where they're at coming home. But you know, so I think that as far as risk of aspiration, you know, you'd look for if there was reports of them choking, and so you could look at what specific textures, solids or liquids, as far as what was causing the difficulty, and address changes to those if need be, all kind of keeping in mind that you want to have the person be able to enjoy as free or as close to what they had been used to for their diet, but while remaining safe.
So do we work with the nutrition, or you receive notes from the hospitals or the rehab's nutrition?
Yes, I would. If there were changes in, you know, some of the signs and symptoms of a swallowing problem, or that there is aspiration going on, would be loss of weight or you know, changes in nutrition, and certainly consulting with a nutritionist or dietitian would be important, and they could be an important part of the team.
Absolutely.
Yeah.
What are some other tips you can give that you've shared with family members and patients in this time?
You want to go?
To you know, watch and care for their family member if they notice any changes, let's say in their cognition or their neural status, if their weakness is progressing from that stroke. You know, dietary needs, let's say if they're on blood thinners, they want to, you know, moderate some of their diet, and making sure they're taking their medications, and just being safe.
Let's talk about your care. You're not in there 24/7. You make certain. What's a typical visit schedule like? I imagine it's different for every patient, but a typical visit schedule. And then what can family expect when you're not there, and how can they reach you if they have questions or concerns, or what should they do?
Sure. I think the visit schedule could differ per patient and family need, and could be more intense in the beginning, and then be reduced, and certainly being available by phone. You know, they would have our phone number, and if they had specific questions, always are welcome to call with those.
Talk about telemonitoring. It makes me think of, you can talk about what the telemonitoring system is, and how does that help with these kind of patients?
So the telemonitoring system is a system that monitors weight, blood pressure, and oxygen saturation, heart rate. Most of our patients who require telemonitoring have maybe a history of heart failure. They probably have stroke, or maybe a combination of the both. So every morning, when we go into the home, the patients are educated on how and when to use the equipment. They do it every morning. All of their vital signs go into our system, and we have a nurse that monitors that information. So basically, the patients do it same time every day, usually before they have breakfast or anything like that. And we talk about, you know, how they're feeling on that particular day. If they feel like their weight's going up, let's say if it's heart failure, if they feel like they're not breathing well, and what to do, and to call us.
So it's a direct line, really, because the telemonitoring system is sending data to a computer to a nurse in the office. So when you aren't visiting the patient, we still have a touch base to see how they're doing, and
that's right.
That's really important. It's very nice.
It's a great program.
Yeah, that's wonderful.
I was just going to add in there with that. So it's a procedure, and a patient would probably have to be taught and you know, practice. And so it made me think of your question about the tips. You know, certainly like role playing. So out, you know, scenarios that would involve communication would be a part of our therapy as well, and sort of practicing those steps, or practicing going to a restaurant, or you know, the things that the client wanted to do.
What kind of communication are you going to use in this scenario, and going through role playing? Oh, I'd never thought of that. That's great.
Yeah, just made me think that these kind of daily routines have to practice, with practice, get better and better.
Right, exactly. So, and that is the goal. Talk about what kind of improvements you've seen in patients.
Sure. So I worked with some clients. You know, you would come home and would have challenges, even making a plan and this would be due to perhaps the motor plan, the praxia, post-stroke that occurs, or the weakness on one side, to be able to plan to go from one room to another and sit down in their chair and be ready to eat their meal, or would maybe perhaps not notice what was missing, and could be part of that visual neglect that a client post-stroke could possibly have. And so in my work, I've noticed that through the therapy, towards the end when they're ready to be discharged, it's pretty amazing that they've been able to work through that plan and sit down and enjoy a meal and know, and with some cueing perhaps still be able to know what to ask for to complete that routine.
That's wonderful. It must be so great to see those improvements happening, being a part of that.
Absolutely.
What are other, we're talking about stroke, you've mentioned heart disease, talk about some other diagnoses that you help support.
Sure. So for adults, we receive referrals for diagnoses like Parkinson's, ALS, Lou Gehrig's disease, MS, multiple sclerosis, brain injuries, could be cancer of the head or neck, and as well as developmental disabilities and communication delays and disorders in children too.
Oh yes, thank you. Mentioning we do have a therapy team for adults and children, and you do a little bit of both as well.
Right, yeah.
And talk about how those differ, how they're the same.
Sure, so we would get referrals in the same manner from the doctor, family, or a community agency, and then we would assess for where the delay or the disorder was causing a functional challenge, and then we would come up with a plan for treatment. So in that way, those are some of the similarities. We tend to see children over longer periods of time. Certainly there's the focus of wanting them to improve and close that gap of any delay, but our services are I guess slightly more educational in nature, although we're working with the family and how to help the child fit into their daily routines. And so again, in that way, it's similar to adults.
How young do you start?
Sure. Referrals generally come in between 18 months and 3, but certainly for children with feeding difficulties or challenges, it can be earlier.
Sure.
Yeah.
And you also our home health care team is primarily adults or young adults with disabilities, is that correct? And then
Yes.
therapies will focus more on some of the children and
Yes.
children's issues. Another thing we haven't mentioned here is hospice care. Can you give us a quick overview again of hospice and also how these therapies help hospice care?
Sure. So hospice, as everybody knows, is end-of-life care. However, I've lost my words.
That's okay.
That's okay. So once the patient, let's say a stroke patient, maybe has another stroke, has repeat visitations to the emergency department or readmissions to the hospital, and their condition progresses, we can continue to take care of them at home and keep them at home through our hospice program. Basically, it's monitoring signs and symptoms, treating them. We're very involved with the patient, the family, the physician, and we do everything to keep them comfortable at home. Sometimes, not in stroke patients necessarily, but even heart patients, they sometimes get better, and it allows them to have a really great quality of life. They can concentrate on their families and what they want to do, and then we just continue to support and educate.
So as in all of our programs, hospice or home care, you would make assessments and bring on therapies as needed, if needed. And some of our therapists are trained in hospice. Our speech therapists are there for certain conditions that are needed.
Right, and I think the focus would be likely on support strategies and how the communication partner can support that person in feeling comfortable and having their needs met in a way that helps them have a quality of life that is acceptable for that time in their life.
Yeah. Wonderful. So we're coming close to the end of time. And anything else you'd like to share about speech therapy or with stroke victims or any the people that you see?
Sure. Well, it's just, I think one of the real pleasures of working with home health is getting to know the families and how many different people that you end up speaking with in a particular day. It's a real joy and interesting part of working for home health. And so I just take away there's a lot of joy in it. We're helping people who have had a sickness or an illness, but there's a lot of happiness that comes from our communications with our clients.
Absolutely, well said.
Yeah.
This keeps a little bit of variety and
absolutely.
And people, as you said, we're caring for a patient and their whole family, and that's a great way to look at it. And what have you enjoyed about home health care since you've switched gears?
I would have to agree with Eugenia. We're out there in the patients' homes and learning about them and talking with them. It's great to have that ability to see people come in ill to their home, even though they've come through rehab, but to get them back into their everyday routine at home is quite fulfilling, and it's a very gratifying thing. And if people tend to get sicker and we take care of them in hospice, that again is very rewarding, and I'd say the best decision I've made as far as career.
Wonderful. We're glad to have you.
Thank you.
So we should remind folks again how to be referred to home health care if a loved one needs it, or if they're anticipating a surgery or a visit to the hospital, or if they're in the hospital now and someone's what should they be? What kind of conversations should they be having with their doctor, and how are they referred to home health care? Can you remind us?
So most of the time the doctor should prompt the patient. However, if the patient's uncomfortable about going home, and this has happened, to feel free to talk to their physician and advocate. If the patient can't clearly do that, family could also advocate for the patient, and talk to the physician about wanting to be home, and the nerve, and calling home health. Really understanding it, hopefully we're communicating through the community, the services that we provide. We have nurses, we have LNAs, we have personal care attendants, SLP, OTPT, volunteers. We run the gamut on a lot of things that we can use to keep the patients home with their families and get better.
Yeah, wonderful. So they can talk with their doctor, talk with their care providers, call our agency, and I'll give that number again at the end, and certainly look us up online, and be thinking about this kind of care before we need it too as well. So I want to thank you both for taking the time to be here today, Eugenia and Jeanne, and for the wonderful work that you're doing with so many people here in our community. We thank you very much.
Thank you, Jen.
Yeah, thanks for being here. And thank you for watching. If you have any questions about Franklin County Home Health Agency's programs or services, please call us at 527-7531 or visit us at www.fchha.org, and we'd be happy to help you or a loved one with home care, hospice, or planning end-of-life care, or helping you at home after an illness or surgery. Thank you again for watching, and be well.